Hello friends, today we will discuss about the periodontiums. Anatomy of the periodontiums. What are periodontiums? Periodontiums are the supporting structures of the tooth. There is a diagrammatic representation of the tooth, in which we are showing that there is a coronal tooth with their root, and there is a gingiva, periodontal ligaments, alveolar bones, and cementum. Normal periodontium consists of gingiva, alveolar bone, periodontal ligament, and cementum. Gingiva. What's the function of gingiva? Gingiva to protect the underlying tissue, attachment apparatus, PDL, cementum, alveolar bones. We divide periodontium into two parts, in which gingival part and we have attachment apparatus. In gingiva, we protect the underlying tissue, and the attachment apparatus we have PDL, cementum, alveolar bones, which attach the tooth in the sockets. Oral mucosa. The oral mucosa is a mucous membrane lining the inside of the mouth and consists of a stratified squamous epithelium. Oral mucosa. We have three types of oral mucosa. We have lining mucosa, we have masticatory mucosa, we have a specialized mucosa. As name suggests, there is lining, masticatory, and specialized mucosa. There is a diagrammatic representation of the oral cavity, in which we have designed a diagrammatic representation of the masticatory mucosa, lining mucosa, and we have specialized mucosa. The part shown by the dark gray colors is masticatory mucosa, which consists the area of hard palate, alveolar tooth sockets, around the tooth sockets, and lining mucosa all about the lips, buccals, lower lips, upper lips, floor of the mouth, gingiva. A specialized mucosa we have only the surface of the tongue, which consists of the taste buds as well. Masticatory mucosa is a tissue that is firmly attached to the underlying bones epithelium. It is covered by the keratinized or parakeratinized epithelium. Masticatory mucosa help in the mastication, so it needs such firmness to overload to bear the masticatory load. For these, they are covered by keratin layers on their epithelium, function to withstand the friction during mastication. Example, gingiva and a hard palate. Lining mucosa is a composed of oral tissue that are loosely attached to underlying structures, epithelium, non-keratinized epithelium. Examples where the lining mucosa are present are lip, soft palate, floor of the mouth, cheek, uvula, alveolar mucosa. And we have a specialized mucosa. It is also known as special because it has papillae and taste buds. It is present on the dorsal surface of the tongue. As name suggests, there is a specialization of the mucosa, as because the mucosa have taste buds which receive taste from the oral cavity and give sense to our brain. Gingiva is a soft tissue adjacent to the cervical portion of the tooth. It is attached to the tooth and provide covering the tooth. Gingiva, we have three types of the gingiva. We have marginal gingiva, we have attached gingiva, and we have interdental gingiva. There is a clinical picture showing the all types of gingiva. Marginal gingiva is around the cementum enamel junctions, and there is a margin on the margins of the tooth present, and these are called marginal gingiva. And the attached gingiva is from the groove from the mucogingival groove to the marginal gingiva, there is attached gingiva which cover the periosteum, and there is mucosa. There is a diagrammatic representation of the types of gingiva. We have shown here attached gingiva, we have gingival margins here, we have free gingiva, and the above portion from the marginal gingiva is known as free gingiva, and there is alveolar mucosa which cover the alveolar bone, and we have vestibules here. Marginal gingiva, it's the most coronal position portions of the gingiva. It is not attached to the tooth and create a shallow depressions known as gingival sulcus. Healthy features of the marginal gingiva are nicely edged contour, firm consistency, and smoothing in texture. It extends apically into free gingival groove and correspond to most coronal aspect of gingival attachment to the tooth. And we have attached gingiva just apical to the gingiva and a free gingival groove. We have attached gingiva. The healthy features of the attached gingiva are taper in contour, stippling in nature. Stippling means that we have orange peels appearance. There is a small groove on the surface, and this texture is called stippling in texture. And for consistency, disease, stippling, reduce, extension, coronally free gingival groove, apically mucogingival junctions. Function, withstand mechanical forces of tooth brushing, prevent movement of marginal gingiva. Here is a clinical picture showing again marginal gingiva, attached gingiva, and alveolar mucosa. Interdental gingiva. It is located in the interproximal space of the space created by adjacent teeth in content. When the two teeth are in content, there is a space between them. That place is known as interproximal space. The gingiva present between these space is known as interdental gingiva. It is generally triangular in shape and depend on proximal contact of teeth. In the buccolingual dimension, the interdental gingiva terminate coronally with separate buccal and lingual peaks of the tissue joined by a depression called gingival caul. And there is a clinical and plus there is a diagrammatic representations. In clinical picture, there is a rectangular box showing the interdental dental gingiva, which is a triangular in shape, and diagram B we have shown that what is called the space, the distance between two interdental gingiva is known as caul. Gingival sulcus is a shallow depression between tooth and marginal gingiva. Probing depth of the gingival sulcus, it is determined clinically by periodontal probe. It is normally 1 to 3 millimeters. Circular epithelium. Sulcus is lined by non-keratinized epithelium and extends from the crest of the marginal gingiva to most coronal level of junctional epithelium. It is located apical to the circular epithelium. It attaches gingiva to the tooth. And there is a diagrammatic representation of the gingiva. Junctional epithelium, circular epithelium. Now we differentiate between healthy and diseased gums. Color of the healthy gums are coral pink, and disease 1 red, blue, and white based on their severity and their conditions of the disease. Texture: in healthy, it has smooth and firm texture and shows stippling. In disease, less firm and stipplings are also reduced. Contour of the healthy gums smooth and scalloped appearance, and in disease state swollen and empty interdental gingiva area. Connective tissue: gingival connective tissue. Connective tissue of the gingiva is known as lamina propria, divided into two layers, papillary layer and reticular layer. It consists of collagen fiber, intercellular ground substance, cell, blood vessels, nerve cells. In cells we have fibroblasts, lymphocytes, mast cells and plasma cells. Gingival fibers: gingivo-dental fibers, circular fibers, transseptal fibers. Vascular supply: supra-periosteal arteries, interdental arteries, periodontal ligaments, arterioles. Neural innervations: neural innervation of the gingiva is derived from the maxillary and mandibular division of trigeminal nerve. And they are buccal gingiva of posterior teeth of the maxillary teeth are supplied by the superior alveolar nerve. Facial gingiva of the anterior teeth of the maxillary arch is supplied by labial branch of infraorbital nerve. Palatal gingiva of the interior teeth of the maxillary arch is supplied by the palatine nerves. Palatal gingiva of the posterior teeth of the maxillary arch is supplied by the anterior palatal nerves. Buccal gingiva of the posterior teeth of the mandibular arch is supplied by the long buccal nerve, which also supplies the buccinator muscles. Facial gingiva of the anterior teeth of the mandibular arch is supplied by the mental nerve, which is an extended part of the terminal branch of inferior alveolar nerve. Lingual gingiva mandibular teeth mandibular arch is lingual nerve. Gingival fluid. What are gingival fluid? Also known as gingival circular fluid, and it is continually secreted by the connective tissue into sulcus containing sticky plasma proteins which improve adhesion of the epithelial attachment, have antimicrobial properties and exert antibodies activity. Periodontal ligaments, composed of the tissue that surround the tooth, the root of the tooth and surface attachment of the alveolar bone. The chief function of the periodontal ligament is to connect or to attach the tooth to the alveolar bones. It consists of intermingling fibers known as principal fibers of the periodontal ligaments. Average weight of PDL is 0.18 mm. Principal fibers of the periodontal ligaments are alveolar crest fibers, horizontal fibers, oblique fibers, apical fibers, interreticular fibers. There is a diagrammatic representation of the principal fibers of periodontal ligaments. There is transseptal fibers, there is alveolar crest, horizontal group, oblique group, apical group, interreticular group. As name said, alveolar crest. Alveolar crest attachment are from the cementoemal junction to the crest of the alveolar bones. Oblique fiber are from the cementum to the alveolar bones. Apical from apex of the tooth to the underlying bones. oblique from the fibers run obliquely from cementum of the root to the alveolar bones interradicular area in the posterior teeth, like premolars, molars, they have two roots. So in the bifurcation area there is a fibers of perials which connect it to the underlying bones are known as interradicular fibers. Function of perial: mechanical function, formative function, nutritive function, sensory function. Mechanical functions known as they provide mechanical function to bear the forces of the mascatory. Have a formative function, they are a living tissue. They can regenerate if there is any disease. If there is any kind of disease, they also regenerate. Nutritive functions: they have blood supplies and give nutrition to the tooth. And there is a sensory fibers also, as that we can sense that our teeth are in the sockets. Alveolar bones is a bony process that projects from the basal portion of the mandible and the maxilla, composed of spongy bones covered by the outer covering known as cortical bones. Alveolar process have the sockets for attachment of the tooth. The spaces that accommodate teeth are known as alveoli. Alveoli are lined by a bony process called cupriform plate of alveolar bone proper. These layers of the bone show white line on the radiograph known as lamina dura. And here is a beautiful radiographical image showing the periapical radiograph showing the anterior teeth. And here is the alveolar bone showing alveolar bone. There is a lamina dura, and there is a bone, cortical bones. This is a very beautiful radiographic picture showing the teeth and alveolar bones. We have there is a diagrammatic representations. We have tooth. Around the tooth we have perial fibers, and around the perial fiber we have alveolar bones, and we have buccal cortical plates and lingual cortical plates and tubercular bones. Cementum is the last portion of the periodontium. It is classified as a calcified tissue that covers the root of the tooth and provide means of attachment for periodontal ligament fibers to the tooth, made up of 45 to 50% inorganic material, 50 to 55% organic matters, and water. Types: we have two types of cementum. We have acellular cementums and we have cellular cementums. As they are also known as primary and secondary respectively. Acellular cementums are found from the cervical margins to the apical third of the root. The chief function of the acellular or primary cementum is encourage support or encourage to the tooth in this socket. Cellular or secondary cementums locate from the middle to the apical third of the and furcations area of the roots. Functions of the cellular and secondary cementums are adaptations and repair. Function: to provide attachment to the collagen fibers present in the periodontal ligaments. These help maintain the integrity of the root and its position in the gingiva and the bone. Cementum is also deeply involved in repair and regeneration of the tooth. There is a diagrammatic representation of the cemento-enamel junctions. Is the area of the tooth where the enamel of the anatomical crown ends on the root surface. On the basis of cemento-enamel junctions, we have three types of the cementum. We have number A, we have cemento-enamel junctions, that enamel and cementums are move apart and the dentin is literally exposed. In picture B, there is cementum and enamel form a bud, and in picture C, cementums and enamel overlap each other. Thank you very much.